cancer diagnosis often becomes a very depressing and bleak scenario because at the moment your doctor delivers the horrific news, your world is completely turned upside down. Patients are often left with a flurry of questions, which usually includes the question of, what are my treatment options? Generally speaking, there are three main types of cancer treatments, including surgery, chemotherapy, and radiation. Factors that determine the optimal form of treatment primarily include the type of cancer as well as the current stage of your illness. Surgery is often the first treatment used if the cancer can easily be removed from the body. In some cases, radiation may be used to shrink the cancer prior to performing surgery. Chemotherapy, also known as chemo, is a drug treatment used by doctors that allows drugs to travel through the bloodstream to reach other cancer cells that may have spread away from the tumor. When undergoing chemotherapy, it is important to understand the many side effects that can include nausea and vomiting, appetite loss, hair loss, and mouth sores. In addition to these adverse effects, chemo can damage blood-making cells in the bone marrow, which can lead to a higher risk of infection, bleeding or bruising from minor cuts, and anemia, which results in tiredness and shortness of breath. In order to combat the many effects of chemotherapy, many cancer care teams work carefully with patients to manage the side effects of chemo. Lastly, radiation therapy is a treatment in which high-energy rays are used to kill and/or shrink cancer cells. Oftentimes external radiation is used, and even though it doesn't physically hurt during the initial process, like chemotherapy, there are many side effects involved with this form of treatment. Skin irritation and fatigue are the most common side effects resulting from radiation therapy, and these often last for many weeks even after the treatment period concludes. Some individuals believe that cancer treatment is actually worse than the cancer itself due to the many side effects that can greatly reduce the quality of life that remains. However, this belief is very dangerous because this thought process can prevent those individuals from receiving the treatments that can save their lives. For the most part, these thoughts occur when treatment initially begins, because in the early stages of cancer patients have yet to experience any symptoms or problems. Patients then come to the conclusion that the cancer treatment is the source of many side effects that often result in pain and discomfort. For people in this situation, it is important to discuss treatment options and your future plans with your doctor in order to clearly understand the likely outcomes of both treatment and non-treatment options before making a decision. If cancer is allowed to progress without treatment, symptoms will become worse and new symptoms will continue to build up over time. As symptoms become more and more developed, curative treatment options may no longer be available to the patient. Statistics have shown over time that untreated cancer commonly causes death, where in contrast cancer treatments often save lives, especially when cancer is found and treated early in the process. All in all, it is very easy to get discouraged due to the uncertainty and painful side effects caused by various treatment options, but in the long run it is worth it for both you and your loved ones.